Hello everybody, my name is Panida Piyachaturawat from Divisions of Gastroenterology, Chulalongkorn University and King Chulalongkorn Memorial Hospital in Thailand. Today, I would like to share our recent article in gastrointestinal endoscopy titled Single Operator Peroral Cholangioscopy Assists cystic duct cannulations for transpapillary gallbladder stentings in moderate to high surgical risk patients with acute cholecystitis. I would like to acknowledge my co-first order, Associate Professor Viriyapon Rititit, and my corresponding order, Professor Rangsan Rernimit from the same institute. Currently, surgery is the standard treatment for acute cholecystitis. In real practice, the challenging scenario is the decision-making for those patients with moderate to high surgical risk patients. The alternative treatment for gallbladder drainage are percutaneous and endoscopic approach. However, percutaneous and EUS gallbladder drainage have limitations in patients who have ascites, thrombocytopenia, coagulopathy, or inaccessible gallbladder anatomy. Another option is endoscopic transpapillary gallbladder stentings. Based on the previous study, technical success rate for endoscopic transpapillary gallbladder stentings vary from 50% to 96%. The main reason for failure is unable to identify and assess the cystic duct under fluoroscopic guidance. Cholangioscopy may be helpful for cystic duct cannulation under direct visualizations. However, this data limits to just only small case series and a few case reports. Therefore, the aim of our study is to determine the efficacy and safety of single-operator cholangioscopy assist gallbladder stentings in moderate to high surgical risk patients who present with acute cholecystitis. Our study is a retrospective study involving 104 moderate to high surgical risk patients with acute cholecystitis who underwent endoscopic transpapillary gallbladder stentings between 2015 to 2019. Endoscopic transpapillary gallbladder stentings were done in three steps. First, cystic duct cannulation. Second, gallbladder guidewire placement. And third, gallbladder stent placement. When cystic duct cannulations was not achieved within 10 minutes under conventional fluoroscopic guidance, a cholangioscope was then used to explore the bile duct and the cystic duct orifice under direct visualization. Out of 49 patients who have failed conventional fluoroscopic assist gallbladder stentings, we found that cholangioscopy assist gallbladder stentings increased the technical success rate even after failed fluoroscopic guidance from 53% to 75%. Based on our data, cholangioscopy assist endoscopic transpapillary gallbladder stentings is beneficial for those with cystic duct orifice located posteromedially and anteromedially, which could not identify despite multiple technical manipulations, including patients or C-arm fluoroscope rotations, and those with complete obstruction with no contact scenes in the cystic duct on a balloon occult cholangiogram. However, these were still 26 cases where both modalities could not achieve gallbladder stentings. The main reasons for failed cholangioscopy assist cystic duct cannulations were unstable cholangioscope positions, aberrant cystic duct taking off from the right intrahepatic duct, and a solid-like cystic duct opening. While the cause of successful cystic duct cannulations under cholangioscopy guidance but failed gallbladder guidewire placements were impact cystic duct stone, sharply angulated cystic duct, and small and tortuous cystic duct. A recent study on cost-effectiveness of endoscopic gallbladder drainage in poor surgical candidates demonstrated better in those receiving endoscopic transpapillary gallbladder stentings compared to those who received percutaneous approach and EUS gallbladder drainage. However, the detail of single-operator cholangioscopy was not addressed. As we know, the cholangioscopy can be costly, and the manufacturer allows only one-time use. In this study, we use it under a special protocol supported by our research funds. Perhaps the future study might focus on this specific issue. Based on the presenting data, we conclude that single-operator cholangioscopy assists endoscopic transpapillary gallbladder stenting can increase the technical success rate after failed fluoroscopic guidance. Endoscopic transpapillary gallbladder stenting should be considered as an alternative gallbladder drainage in patients with acute cholecystitis who are not a candidate for cholecystectomy during the attack of acute cholecystitis. However, single-operator cholangioscopy guidance is not helpful in those with very tortuous and obstructed cystic duct. Thank you.